right now about Americans in general and minorities and Latinos in specific. According to the Centers for Disease Control, about 1.7 million Americans have been infected by HIV since the beginning of the epidemic. And there are 1.2 million Americans that are living with HIV today. Every year, there are 40,000 new HIV infections in the United States, and about 1/4 of the people living with HIV in the United States do not even know that they're infected. As alarming as these statistics may be, the CDC is expected to release some new data later this year, which could indicate that HIV infection levels are much higher than previously reported. As I'm sure most of you know, HIV/AIDS is spreading rapidly among racial and ethnic minorities. Minorities now represent 70% of all of the new AIDS cases, 64% of Americans living with HIV/AIDS, and 72% of deaths among persons with AIDS. Hispanics now account for 19% of all the new AIDS cases, although only 15% of the population is Hispanic. Hispanic women represent 16% of new AIDS cases among women, and Hispanic teenagers ages 13 to 19 represent 17% of the new AIDS cases among teenagers. Hispanic Americans accounted for 14% of the deaths due to AIDS in 2004, and listen at this one. In Los Angeles County, the impact of HIV/AIDS on Hispanics has been especially severe. Hispanic Americans have surpassed African Americans as the most severely impacted ethnically in Los Angeles County. Of the adult and adolescent AIDS cases diagnosed in 2005 in Los Angeles County, 25% were white, 25% were black, and 46% were Hispanic. That is why the work of organizations like Minister are so very important. We desperately need the service, outreach, and advocacy organizations that are committed to improving the health and well-being of the Latino community and other underserved communities. As I walked in, I heard the presenter talking about the Minority AIDS Initiative. I created the Minority AIDS Initiative under Bill Clinton. Been very, very helpful in helping to provide some assistance with communities that had not been involved in organizing so that they could get more into responding to requests for proposal and all of that. But it's far too little. It certainly is not enough, but that's this administration. Let me just tell you about why I'll be so glad when George Bush is gone. The President's budget proposes to increase Ryan White funding by only $1.1 million this year, while it would require an increase of $614 million just to meet the needs of the country. The President's budget proposes to cut funding for HIV, tuberculosis, hepatitis, and STD prevention programs at the Centers for Disease Control and Prevention by $2 million this year, while it does require an increase of $832.6 million to meet the needs. The President's budget proposes to cut funding for the Minority AIDS Initiative, $15.6 million this year, and that's after flat funding the Minority AIDS Initiative at about $400 million for the last 6 years. I'm calling for no less than $610 million for the Minority AIDS Initiative this year. On March 19, 2008, I sent a letter to the House Appropriators requesting an appropriation of $610 million for the Minority AIDS Initiative in fiscal year 2009, and 79 members of Congress signed my letter. Full funding for the Minority AIDS Initiative, Ryan White, the Centers for Disease Control and Prevention, and other critical health programs is critical if we are to stop the spread of HIV within the Latino community and within all communities affected by the tragic disease. I heard some mention of a national strategy. I support a national strategy. It's time. It's time. time for a national strategy because we have never organized how all of the sectors of our society can contribute and be involved in dealing with this crisis. We need to have goals. We need to have a strategy. We need to understand what steps we can take to reach these goals. You know, we talk a lot about national planning, but we really have not heard this kind of discussion when we talk about HIV and AIDS. As a matter of fact, as I said earlier, and I like to interject a little controversy because they get the blood flowing. I've endorsed a presidential candidate, many of you have endorsed a presidential candidate, and they all talk in general about comprehensive universal health care, but I have not heard them really talking about HIV and AIDS. I have not heard them talking about a national strategy. I have not heard the words come out of their mouths in these debates. I have not heard them stand up and really take a position on HIV and AIDS. And some people say, oh, they sent us a paper. That's good. Talk about it. Talk about it. When you talk about national health care, it does not take a Harvard scientist to segue right into HIV and AIDS. So I'm a superdelegate, and as a superdelegate, I'm going to be worried that the campaign is going on too long. No, it's not. Let's let the candidates go to the bitter end. Let them go to every state. Let people have the right to vote, and let every vote be counted. And if it means we go into the convention without a nominee, so be it. We can fight at the convention. That's all right. There's nothing wrong with a good fight. Going into the convention without a nominee, and how they're going to be going after every superdelegate for a vote. And they will be chasing you down, calling you, knocking on your door at the hotels, and you get a chance to look people in the eye and say, what about? I want to talk with you about HIV and AIDS. I want to talk to you about mandatory minimum sentencing. I want to talk to you about the issues that do not get aired in the debate. I want to talk to you about what's really ailing America, but is not quite politic to talk about in these national debates. And so I'm hoping to use that opportunity to force some commitments on funding and a national strategy so that we can have someone going into the White House, hopefully, with an understanding that this must be a part of their national agenda. So let me take a moment to just thank all of you for the work that you're involved in. I must tell you that almost every day or every week or every month, I meet people who are working on HIV and AIDS, people who themselves have been living with HIV, who've been living with AIDS. And they get up every day and they try and do something to help educate, to help outreach, to beg for money, to assist a friend, to assist a family member. And I want you to know I have the greatest respect and admiration for people who are living with HIV because they could simply say, I've got to worry about myself. I don't have time to think about anybody else. But people who take trips to Washington, D.C., who put up with walking these awful halls, knocking the doors of legislators who are never there, who are constantly begging for money when they see us spending billions on the war in Iraq. I mean, it's easy to be discouraged. But you keep coming. And if you keep coming, I'm going to keep going. I'm going to keep going after the money. I'm going to keep going after the resources. I'm going to keep singing the song. And I'm singing the song for everybody. I'm singing the song for those people who are the victims or who are infected. I'm singing the songs for those young people who still don't have enough sense to get it. We've got to keep after them. I'm singing the song for our communities, oftentimes that are non-responsive. And I'm particularly singing the song today for the Latino community. It's been a long time in coming. I don't know if there has been just a resistance to the discussion because of the nature of HIV and AIDS, or whether or not someone was looking for someone else to do it. But I want you to know Benestar must be thanked for being in the forefront of